This is a video to show you blood administration. So I'm currently in PowerChart, which is a dashboard that's going to show our nursing tasks. You can also access tasks via FirstNet, Maternity, Whiteboard, or in tasks within the patient record, for example, if you're working in recovery. So I'm in Care Compass at the moment. This is the patient that I'm going to look at. I may have had verbal communication to say that this patient requires a unit of blood, and I can see a task on here saying transfuse first unit red blood cells, any clinical details, the reason for the transfusion being needed, how long this unit is going to be transfused over, and any special requirements. I'm going to navigate to my patient record, and I can also see this prescription under care plans. So here you may have others which sit below under our medical care plans. We have a neonatal blood transfusion care plan as well as paediatric. Within here there may be platelets or cryoprecipitate or fresh frozen plasma, along with any medication that needs to accompany this prescription, just like you would on your blue forms. So I can see the TACO checklist has been done. There's a prompt for consent obtained. This will be done on paper, as well as there being some reference text that we can still look at on paper. For example, in paediatrics, the blood transfusion is prescribed in mils, and that calculation is on there. We've also got patient information leaflets on our blue transfusion forms. So there is a prompt here, say consent obtained. You can document in plan here and say, for this one, that the consent has been obtained so that everyone knows that you've checked. Anything else that's usually documented on the blue form, for example, the prescription, the vital signs, the unit number, is now done on EPR. We've got a line here, red blood cells order, and this is what goes to the lab with any details. And then this is our nursing task, but it also acts as our prescription. This is where the clinician prescribing will tell you exactly what has been prescribed. So we've checked our prescription in two places. In our assessment and fluid balance, we need to make sure we've got blood components administration visible. This is how we record our unit. And just to note that blood track and autofating will still continue in exactly the same way it does now, and it's not connected to our EPR record. So you would check for the unit, print out the pickup slip, you would obtain from a satellite fridge or call the help desk to get the porters to obtain that unit for you as you normally would. You'd be scanning the patient wristband, which should be in situ as you're putting the unit up and going through your checklists. Now, just to note, we would also be doing a set of pre-transfusion observations, so I'm going to show you how to do that now. In Millennium, you can document in your usual vital signs section. You can also do this via Medinets, and it will pull through into this column because essentially it's the same detail, but just viewed in different ways. So I'm just going to put, as I have done previously for some training before, just a 20 for respiratory rate. But if you imagine you've entered all of your vital signs required for your pre-transfusion observations in here. Again, so we've got the unit of blood and we want to record putting it up. So we go to red blood cells. Again, you would go to whichever other product, if applicable. I'm going to stick with red blood cells because that's what we have a prescription for. This is a repeatable group boxes. You click on there. You click one, and it depends on which number of units you've given during that episode. You can scan the blood unit number. It will give you your unit number. It will have those 16 digits, but it will also have 2 extra digits at the end, which is because if you have a look at that G unit number, it's got a letter on the end of it and it doesn't recognise it as a letter, so it'll input it as 2 digits. You don't need to change this. The transfusion team are happy. You can just leave it how it is. And click OK, and then it's changed the title of this to 1, 2, 3, 4. So I'm just going to input a few details in here. I'm going to say that this respiratory rate here is my pre-transfusion observation. So if I go down, perfect. Sorry. I can go to observation type. They're my pre-transfusion observations. Great, let's tick that off. Then when we're putting the bag of blood up, using your PDA device as usual, as I've mentioned a few times now, but I just really want to stress that, use that in your normal way. We're going to do patient identified, if we've checked the cannula, when we're starting, so I've put a T for today. If we've halted it, there's a free text box here. We're not doing observations as we're hanging the blood. Nothing's gone through yet. You will have a space for your rates, your mils an hour. So maybe I'm going at 200 mils an hour. Calculated duration, it won't say calculated because we've built this ourselves, and we at one point we're looking at having a calculated duration. It doesn't work that great, so we just want to put in as simple and easy and clear as possible what we need to record as part of our administration process. So we've got the rate here. The volume will, whatever you put in that box, will go into your fluid balance chart, which is fantastic. Now you could do that at the end, which lots of places around UHW do, or you can read it hourly, like places like pediatrics do. So I'm going to tick that. By the way, newborn screening blood spot test is for if the baby's less than 5 days old, you need to do that blood spot test before any blood transfusion. So that's just a prompt. So I'm going to tick that off. Prompts me for my witness. You input who's checking that with you, and then they'll put their password in, just like if you were doing medication. There we go, that's it recorded as you've hung that blood. And after 15 minutes, very similarly, you would put your vital signs in either on Medinets or through PowerChart, and I would allocate those as my 15-minute observations. And then when you're ending your transfusion, we can put transfusion ended. We'll put completion observations, which again, just input in the normal way, really easy to follow that column down and select completed. You can put the amount of blood that has gone through, tick that off. And that's your transfusion documented, your start, stop times and your observations in here. There's just one more thing that we need to do. So remember there was a task on Care Compass, this one here. We can now tick off that task, and there is a way that we do this. We click on it and click document. And then if we click in this box, we choose yes, tick it off. And then on Care Compass, that task will drop off for us so that everyone knows we have given that prescribed blood transfusion.